Getting sun exposure of the skin can be a very nice way to activate vitamin D in the skin. That's how humans are supposed to get their vitamin D. But it doesn't always work out like that. The reason for that is as we get older, we progressively lose the ability to activate vitamin D in the skin, particularly after age 40. I saw this play out in very vivid ways when, in my practice, for instance, someone would come in at age 72, say, after an entire winter, wintering in southern Florida, and they'd come back and say, "Oh, don't check my vitamin D. I know I'm good because look at me. I have a dark brown tan, and I'd have small tan lines and dark leather skin. I still check a 25 hydroxy vitamin D blood level, and it would be 17 nanograms per milliliter. We're aiming for 60 to 70. In other words, they still had a very substantial deficiency of vitamin D despite lots and lots of daily sun exposure over a large surface area. So over age 40, you lose the ability of activating vitamin D in the skin, such that by age 55, 60, 65, 70 onwards, you can have very little vitamin D in the body despite having a dark tan. Now this varies. There's an occasional person, say in their 70s, who can activate, who maintains the ability to activate vitamin D in the skin with sun exposure. But the vast majority of people, as they age, lose that ability. Now, even young people sometimes say to me, "Don't check my vitamin D, I get lots and lots of sun." In my experience, most people overestimate just how much sun they've been getting. Now, sometimes it's obvious. If you're a lifeguard and you're outside all day, or you have an outdoor job and lots of surface air exposed in summertime sun, that would be a case where you could get vitamin D, particularly if you're younger. But most people tend to overestimate how much sun they're actually getting. For instance, people work in offices, and when they go outside, they have clothes. So they're getting very little vitamin D, but they get it on the weekends, and that's not enough. So when in doubt, check a 25 hydroxy vitamin D blood level, and you'll know. It's also a good idea to check two vitamin D blood levels, one in the summertime, one in the wintertime. It gives you an idea of how much sun you actually get, how much is activating vitamin D in the skin. So let's say your summertime level is 70, and you only need to take 2,000 units of vitamin D as a gel cap, and the rest is coming from sun. But let's say in January, February, after several months of being deprived of sun, and you're only taking 2,000 units, your level is now 31. So that's a good example of a person who needs to add more vitamin D in the winter months, maybe 6,000 units or 8,000 units to get a full, to reach our target of 60 to 70 nanograms per milliliter. Now you gotta wonder, is the progressive loss of the ability to activate vitamin D in the skin nature's way of pushing us out the door after we have served our reproductive functions? In other words, think about it. What are the phenomena associated with vitamin D deficiency? Heart disease, cancer, arthritis, diabetes, dementia, inflammation. In other words, all the conditions, health conditions that are very common and chronic the older you get. On the bright side, restore vitamin D, you are hugely protected from all those kinds of common chronic conditions. I believe it's probably true that this is nature's way of pushing us out the door, and taking vitamin D and keeping your blood level in a healthy range, like our target of 60 to 70 nanograms per milliliter, is our way of, in some ways, outsmarting what nature has intended. If you like these sorts of conversations, I invite you to subscribe to my YouTube channel, or go to my Wheat Belly blog, or my Undoctored blog, and of course my Wheat Belly books and my Undoctored books, and get more about vitamin D and other relevant health issues with a lot of information you can't get anywhere else.